Good evening. Thank you for joining us for another Facebook Live, JeffCo Health Matters, where we talk about the matters of health that matter to our health here in Jefferson County. Thank you for joining us. This evening, I have guest speakers on with the health department, Julia, who is one of our environmental public health specialists, and then Penny, who's one of our public health nurses. We're going to chat our kNOwLEAD program and just lead poisoning prevention. It is October, so this is kind of the month to spread that word. So ladies, you guys just want to introduce yourselves real quick?
Okay. I'm Julia, and I, like she said, an environmental public health specialist. I'm also a lead risk assessor, and I've been working on our kNOwLEAD campaign and just trying to get it going more.
My name's Penny. I'm one of the nurses with the health department. I am the lead case management for Jefferson County. I basically focus on blood lead levels and specifically children, though we watch out for adults too.
Awesome. Thanks, guys. These guys are the lead go-tos with the health department. If there's any kind of lead questions or anything I need lead wise, these are the ladies that I go to. So, well, let's just jump right into it then. The whole topic for this evening is obviously lead poisoning prevention. Our campaign is called kNOwLEAD and just kind of spreading that awareness. But let's talk a little bit about why it's important to talk about this topic in our county. A lot of people, tell us a little bit about the history, Julia, because a lot of people think that it tends to just be a Herculaneum issue because of the lead smelter that used to be there, but that's not actually the case. So give us a little history lesson.
Yeah, it is definitely not just Herculaneum. It is all over the county. But Missouri is actually the #1 producer of lead in the country. It used to be the #1 producer of lead in the world. Back whenever a lot of the mining was going on, the mining took place mostly in our southern counties. This county is just south to us, a little bit in Jefferson County. We were a part of the old lead belt. Mm-hmm. Mostly lead ore and lead mine waste was transported through our county. And then of course there was the lead smelter in Herculaneum that operated for many years. But then also the Big River watershed is contaminated from the lead mining history that we have. So because of that, all of that, Jefferson County is a Superfund site through the EPA. So they've given us a grant to help educate the community about the dangers of lead and different lead exposures, to encourage them to get their kids tested for lead annually, to test the soil in the residential properties, and then if it's high for lead, work with the EPA to get that soil remediated at no cost to the property owner.
Yeah, that you mentioned a lot of stuff. So we're going to break that down a little bit more about all the things that come with grant funding as part of being the Superfund site and different things like that. But I think it's always important to kind of get like that brief history, because like you said, I mean, I didn't know that. I mean, you guys have told me a lot about the lead program, obviously, when we're doing this campaign, but I didn't know Missouri was one of the biggest places for lead mining. So that's a fun fact that you can take home to the dinner table this evening. So let's just kind of get right into lead poisoning. Blood lead levels, this is the testing, this is all kind of your world. Penny, what are some of the highlights of things we want to know? What does it mean to test high for blood lead levels?
Okay, well, we can test several ways, and the number we want to aim for is anything less than 5. We really would like 0, but that's kind of rare because lead is everywhere. But anything less than 5, it's not that we don't worry, but we don't have to case manage, which means I'll follow your child until we get some good lead levels. So when I see a 5 or greater, we automatically reach out to the parent's pediatric doctor and try to find out, where's your child coming in contact with lead. That's our first go-to. If we can find out what it is, we can remove it from the child's environment. And we can test several ways. We used to be able to do on-site rapid testing for lead. There's some back ordering on our test kits, and we're still hoping to get them soon. And those gave you a result right away, 3 minutes. We could get those results. And if your child was elevated 5 or greater, we would recommend to have a venous blood draw done right away. So we're waiting for those, and we hope to have them back so we can start doing that again. The second I mentioned, venous, is where we just draw blood from the arm. We send that off to Quest Lab or State. Takes about maybe 3 to 4 days to get those results back. And once that venous is drawn, you know, we just case manage. We wouldn't have to have your child come back for 3 to 4 months if that level was high. And there was also a few other things that we're checking into. And one of them's a little finger stick, which is what we used to use for our rapid testing. And it's just a little drop of blood on this filter paper, and it gets sent off to a lab. And that lab result can take anywhere from 5 to 7 days. So we don't get those results back as fast. But if our kits aren't in here soon, we might have to resort to doing that just so we're not missing any opportunities. We will also test adults, and we can use the finger stick method on them just like we can children, but our focus is mainly children, basically because they're more harmed. They're still growing, their bones are growing, and lead seems to store in your bones. And as you age and get older, that lead will release over time, causing lots of medical problems if you're constantly exposed.
Right.
So 5 or greater, if you don't know if your child has ever been tested, please give me a call. I can check if they lived in Missouri. I can check to see if they have been tested. And so I can get you those numbers. And if not, then we recommend starting as early as 9 months when they start to crawl around. And that's when they start putting things in their mouth.
Yeah.
All the way through 6 years is our recommendation, but we will do any age of child. And we're fine with whatever.
And it's so the reason that you said that we obviously we test children and we can test adults, but we really kind of push the testing for kiddos. You had kind of alluded to it a little bit, but there's a little bit more risk involved when they're younger because they're still growing, they're still developing. So can you tell us some of those adverse effects if you have lead poisoning?
Yeah, the most of them are focused on neurological defects, behavioral issues, learning disabilities. We have some kiddos, I mean, with the levels get high enough that they're constantly exposed and never discovered in time, it can lead to organ failure, kidney damage, brain damage, and at worst case scenario, it can cause death. Kiddos usually don't get to that point without some kind of health issues becoming apparent, like abdominal pain, weight loss, some GI issues. So usually when you get at that point, you're taking your child to the doctor and they're saying, okay, this child's got a really elevated lead level, and they can treat that with something called chelation. It requires a hospital stay and some IV fluids, and nobody wants to have to do that to your child. And that's why we recommend a lead level every year until they get past that age of putting things in their mouth. So, that's why we focus on those kiddos. Adults usually don't store it like children do because their bones are set and formed, but it's growing children.
And so we obviously can do that testing here, but if folks are interested or want to double check, obviously they can call you to see if their child has been tested, but that's something that pediatricians do as well. So if you're taking your child to their 1 year annual visit or a wellness check or something, you can always check in with pediatricians as well to see about getting lead tested, right?
Yes. And a lot of them do have the rapid test in their office as a finger stick with rapid results. And at some point, there's a little form you fill out saying, yes, 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 no, no, no. If you answered a yes to any of those questions, you need to get your child tested. And one of them is this the first time your child's been tested? And you answer yes to that, they should